So the first thing I would do is I'm going to verify the order and the hospital policy. So I see the order here for trach care and for trach suctioning, and then the hospital policy. And I'm going to now check the expiration date for the saline. It is 12/21, so that means it's not expired. And then I will position my trash can, perform hand hygiene. Then I'm going to do the 2 identifiers with the patient. So Jaguar Jones, MR number 4176352, MR number 4176352. Okay, and so the allergies are aspirin and aspirin. Okay. So I will be explaining the procedure to the patient. So today we'll be doing a trach suctioning and trach care. So I'm going to put my clean gloves on. I'd also provide privacy for the patient. And now I'm going to raise the bed to a working height. And I'm going to lower the side rail. And I'm going to make sure they're in a semi-Fowler position. So also I already have my PPE on, but the order I would have done it in is gown, mask, goggles, and then gloves. And so now I'm going to be setting the suction and the oxygen to, so I'm going to set the suction to 100 to 150 millimeters of mercury and not exceeding 180, and then setting the oxygen to 100% FiO2. So then I'm going to be assessing for any for upper or lower respiratory or airway obstruction. So that would be any drooling, gurgling, nasal secretions, or abnormal respiratory rate. And then I'm going to auscultate now. Okay, so now I would be checking for vital signs. I'm going to put the pulse ox on, and I will keep it on during the procedure. I would assess for signs and symptoms of hypoxia and hypercapnia, and those would be anxiety, dizziness, cyanosis, and decreased pulse oximetry. So now I will be putting this back up and applying the towel. So now I'm going to get my suction kit. I'm going to open it. And then I'm going to take off my clean gloves. And then I will be applying sterile gloves after I perform hand hygiene. Okay. So we're going to put this into the trash. And I'm going to drop the saline out of here. And I'm going to open it. I'm going to make sure the cap don't contaminate. I'm going to grab this out of here, place the saline in here, wrap this around my dominant hand, And then I'm gonna connect these two, this using my non-dominant hand, and now it is contaminated. Okay, so now I will be taking off the O2 therapy, and I'm gonna hyperoxygenate for 5 to 6 breaths for 30 seconds. Okay. So then I'm gonna lubricate the catheter. And I'm gonna press this to make sure that make sure the equipment is working. And I will be putting it in, making sure I don't touch the outer cannula. I put it in at resistance, and then I pull it out a centimeter, and now I'm going to twirl and do intermittent suctioning, and making sure this doesn't last longer than 15 seconds. So then I'm going to make sure the secretions get out by doing intermittent suctioning again. I'm going to roll this up so I can hyperoxygenate, and then I'm going to do 5 to 6 breaths over 30 seconds again. Usually I would wait a minute before doing a second pass, but for time's sake, we're just not going to be doing that today. And then I'm going to be doing it again, doing the suctioning again. So same thing. I'm gonna go in here. Until we hit resistance. Then we pull out a centimeter, and now I'm gonna intermittent suction. Okay. And now we're gonna wrap this back up. We're going to hyperoxygenate one more time. And also, what would have made me stop suctioning was if the breaths per minute drop below 20, increase or decrease, and if the SpO2 went below 90% or 5% below or from the baseline. And now I'm going to be doing putting back the O2 therapy, and I'm gonna take this off from here. I'm gonna take this off, drop the glove, it's gonna stand. Okay, and so now I'm gonna put this on the bedside table. I'm gonna perform hand hygiene. Now I'm gonna put some new gloves on, new clean gloves. What else? I have to get these on because I'm sweating. My hands are sweating. So I apologize for that. I'm gonna be doing auscultations again to make sure that with the secretions that there was a change. I'm sorry. My goodness. Alright, so I'm going to be auscultating now. I'm going to pull this down to auscultate. I'm doing that. Okay, so I did here. Got it, it's better now. So I'm going to put this back. I'm going to now open my trach kit. Put it in the middle. Get my sterile field out. Only touching the 1-inch border. And then I think that my sterile field accidentally touched my PPE, so I just want to let you know that I did break sterility, but we would usually start over, but for time's sake we won't be doing that today. So now we're going to empty the contents onto the sterile field, making sure that it didn't come close to the 1-inch border. I'm going to be grabbing my saline. Palming the label. So now I'll be taking the O2 therapy off. I'm going to be grabbing the inner cannula out, and I'd also grab the drain sponge, but there isn't one today. So I'm going to put it in here. And then I'm going to take off my clean gloves. And now I'm going to apply sterile gloves.
With hands wet.
I'm gonna dry my hands because they're very sweaty, and it was really hard for me to put the clean gloves on, so I can't imagine with the sterile gloves. So now we're going to apply the sterile gloves again. Fix this. My fingers got the wrong one, so we're just gonna fix that really quick. Okay, so now we're going to arrange everything on the sterile field, and yeah, I'm gonna arrange everything on the sterile field. Okay, so now we will be, I would have, just letting you know, when I had my clean gloves on, I would have replaced my O2 therapy, but we'll just say that we did that whenever my clean gloves were on. I would not have done that with sterile gloves on. Would have done it before my gloves were on, or before my gloves were sterile. So now we're going to be getting the brush and the inner cannula. We're gonna be doing it away from the sterile field. Gonna clean inside and outside. And then we'll be throwing this away. And then we'll be putting it in the second. Okay. And then we'll get it out. Just rinsing it. So we're gonna dry it off with gauze. Draw the outside off with the gauze, throw that away, and then get a pipe cleaner to clean the inside. It did drip, but it wasn't in the 1-inch border, so no break in sterility. So we got that. Oh, we got that done. I threw the thing away, and so we're going to be putting it in at 9 o'clock and ending at 6. And then making sure we hear a click. And so we do hear a click, and I'm gonna put this back on. We're going to lower this a little so I can clean the stoma. I'm gonna be getting the Q-tips and putting it in the last section. I'm gonna clean the stoma, going to, or starting here, going 2 to 4 inches away, or 2 to 4 inches each side in every direction. I'm gonna throw that one away and then do the top. Okay. So then we're gonna be, so also throwing that away. And then we would pat dry. And also I would assess any blistering or discoloration or breakdown of the skin under the trach ties, under the or under the trach plate. And I'm going to throw that away. And now I would also put, or I'm going to be now doing the new trach ties. I would also make sure that I kept the other trach ties on before or while I was doing the new ones though. So I'm gonna remove the trach. Okay, do this. I'm not going to be tying it today, but what I would do is tie it in a double knot. I would make sure that if there was at least one finger if it was loose, or 2 fingers for a snug, 2 snug fingers, and it would not be on the carotid area. Then I would cut the old ties off. And so now I will be reapplying the gauze that's underneath the trach plate, the drain sponge. So I would put that underneath. Okay, and so then we put this back up. Or actually, I'm auscultating again, so I'm going to be taking, I would make sure,
5 minutes left. So.
okay, making sure that I put the O2 back on so they can breathe, O2 therapy back on. I'm going to take the sterile gloves off and put some more clean gloves on. So I'm going to be auscultating one last time. Okay, so we're just gonna auscultate to see if the trach care helped. So now we would be lowering the side of the bed to working. Okay, we're to the lowest setting. We're going to be putting the side rails back up, making sure they're elevated to at least 30-degree angle, and we're going to put this back on, remove the towel, And I will now, I would also turn off the suction and the oxygen, or well, I would keep the oxygen on for the trach thing, but not the ambu bag. I would take off my clean gloves, and now I would go to document the procedure. I would document, or I would take my PPE off first. So I'm gonna take I would take my gloves off, my goggles, and then my gown. And then I would document the suctioning procedure. I would document what the secretions looked like, the respiratory assessment, and the patient's response. And then I would document with the trach care that the size and type of trach, and I would also document what the stoma looked like. And